Right, good morning everybody. Welcome to today's webinar. So today we're going to be hearing about the health implications of COVID for community businesses. So we've got about an hour and a half today, which will be about an hour worth of our speaker, Naomi Mwasambili from Chinua, who is a social entrepreneur and expert in health innovation, coming to speak to you today. So Naomi will be speaking to you about the mental and physical health implications of COVID for community businesses, both in terms a little bit about yourself as community leaders and social entrepreneurs, but also a little bit more about, I suppose, the kind of health implications for the communities that you're working with. So she'll be touching on various different issues from the way that you might be connecting with local partners, local authorities, a little bit about on your own well-being and perhaps that of your team. But there will be time for questions at the end, so obviously do make sure to drop a line. So can I just ask Naomi if you'd like to come and say hi? Hello. So as I said, this is you've got here Naomi Mwasambili from Chinua, and I'm going to hand over to you then, Naomi, for the next hour.
Brilliant. Good morning, everybody. Hope you're well. It's a pleasure to be here. As Lucy said, my name is Naomi Mwasambili, and I'm currently in a slightly grey Liverpool this morning, joining you from this webinar. I'll give you a little bit of a background, just a very brief one about me and my experiences, and then talk you through what we'll be doing throughout the sort of next hour of the webinar. One of the things I like to say is webinars sometimes are so one-directional, and as great as sometimes it is to hear my Yorkshire tones, it's really important that everybody who's taken the time to attend and is also watching it back has a space to be able to ask any questions as well, and anything that comes up. So I would say if any questions are sort of like pressing on your mind at the moment or throughout the presentation, please just type them in the chat box, and what I'll do is as we go through the presentation I will respond to them, as I think it's more appropriate to just respond in line with some of the topics that we'll be covering as well. So please do engage in the chat, and then obviously later on we'll have more time to talk. So my name's Naomi. I run an organisation called Chinua. We work on a range of health and innovation projects, mainly focusing around mental health. I guess my social enterprise journey started about 10 years ago now. At the time I was working within the NHS, so a few years before I had worked in research, and then I trained as a psychological therapist as part of a new program that was introduced called Improving Access to Psychological Therapies, that trained a lot of people to provide psychological therapies in GP practices, in community settings, and so I was one of the first sort of recruits for that in 2008. And I guess around that time became really interested in thinking about how you take healthcare out of the GP practices and out of the hospitals into the community a lot more, especially in mental health, because as great as it is having this sort of 1 hour, actually supporting people's health and well-being has to be embedded within their lives, their families and their communities. And for me it was driven by my personal experiences. So my grandma experienced mental health problems, I've had family and friends who've experienced mental and physical health problems, and found at times the process of accessing support, being able to talk and learn about what's going on for yourself, incredibly frustrating. And so, like I guess many people on the call today felt, okay, let me do something about it, and then realized how overwhelming that actually was. However, I've been sticking it out in very range of different guises over the past 10 years. So I actually was an SSE student in 2012 in London, when I set up my first social enterprise, which was community therapies and training services, providing community therapies and training across London. And then for the past 5 years, until this month actually, I've been on the central board as one of the trustees. So I'm very passionate about the role that social enterprise and enterprise can play in healthcare, and specifically driven by people who have personal experiences of the gaps in services and how they can be met in creative ways, and not just within a sort of medical model of care. So yeah, that's a bit about me. I do a range of other different things now. I've started projects from no money. I've started them from a little bit of money. I've scaled them. So I've had a sort of range of different experiences. And I guess throughout this COVID period, like yourselves, I've also been adapting, and our organisation has had to adapt to the changing circumstances that we found ourselves in, where, you know, physical restrictions have been put in place. The services that we're ordinarily providing have had to transform and change, and that being done really, really rapidly, and trying to think of the needs of the people that we're working with alongside the survival of our organisations and our own health and well-being and the changes at home and how we live our lives, is really difficult. So hopefully within this session, what we'll be able to touch upon is thinking about you as community leaders and thinking about your health and well-being, thinking about the wider communities that you're serving, and some of the trends that are coming up, and then thinking about as an organisation how you can meet some of those needs that are emerging, and specifically looking at things over the next 6 months and 12 months, because I think we can never say what's going to happen, but there are some sort of trends that we are seeing, and there is an ability for us to be a bit more responsive to those. So what I would ask is, if anybody has any questions or any topics that they really would like me to cover or to touch upon, please just pop it in the chat. I'll keep looking, and if it's really, really quiet, I'll assume that you're either asleep or I'm covering the needs that you need to. So please do have a bit of interaction. I'm just going to share my screen now, as I have a few slides to share as well. Okay, so hopefully everybody is able to see the slides at the moment. And as I mentioned before, what we'll be covering in this webinar, I guess it's in 3 chunks. Thinking about you, and identifying how to keep yourself physically and emotionally healthy during this time. And I know you've touched upon sort of resilience, and so I guess there's sort of key spotlight areas specifically of like sleep problems and anxiety that I'll be touching upon, as these are things that a lot of people have been, I guess, coming to us and talking about and looking at how they can manage. And obviously now with the seasons changing and the weather changes, these are things that start to impact us as leaders a lot more. Then we'll be looking at, I guess, the community and the community's needs. And I can see from people's introductions that they are based geographically across the country. And so already, as you know, there's different kinds of restrictions that are in place for different people in different places, most of the time utterly confusing, and also fear-inducing, especially if you have a physical place-based organisation, because you don't know what you can and you can't do at times, and what the risks are, especially if you're working with vulnerable groups and communities. And as the policies keep changing and the legislation keeps changing, it's how to keep up with that, but also be able to sort of have the people you're working with in your communities at the core. So we'll be touching on that a little bit more, and then also oh, sorry, I don't know if you can see, I'm trying to get the chat as well as the screen. I'm not sure if I can do that, but also we'll then be touching on your organisation. So looking at opportunities for organisations, and I've seen that there's a range of different organisations really to either move into supporting people's health and well-being, or thinking about how they adapt their service provision. And one of the things that we do a lot of digital and online work, but one of the things we encourage people to do is to just not translate what they're doing offline online, because it doesn't work. And there's something that really needs to be explored around how to create communities and maintain communities in this changing time, when actually the very nature of how we engage as humans is being taken away from us. So I think that's something. And then we'll have a space for question and answers. Okay, that's all right. Okay, so any questions, like I say, in the chat, please do pop them down and let me know. So focusing on, I guess, you for this period of time, and hopefully it's helpful. But I think, again, I've been looking at things well, on a day-to-day basis, really, rather than a 6 month. But I think that with a lot of the policy and a lot of the things that we're hearing, they're looking at a sort of chunk of time of 6 months, and that'll take us to March 2021. And so as an organisation, if we can look at some of the things that we can do over that period of time for ourselves and other people, I think at least it gives us sort of like a benchmark of time to focus on. However, with any kind of uncertainty and any kind of period of uncertainty, that is going to have a direct impact on our physical and our emotional, mental well-being. And so I think one of the things that I always want to push forward is thinking about we support a range of people and we want to help people, but the first person that you need to support and help is yourself. And if you have a family at home, often your family as well. So what plan do you have in place to protect and support your physical and emotional well-being? And we'll touch upon, I guess, some of the things that have happened, sort of physical health, and I'm drawing from some of my personal experiences as well as professional experiences, and also mental health. So I think that with especially the past 6 months and having the lockdown and it shifted and changes, it meant that a lot of people, especially if you're based out and about, have been quite sedentary. And one of the things, and this links into some of the health problems that we're seeing and some of the health issues that we're starting to see present physiologically with people, but sitting down for long periods of time, lack of like physical movement, and people may go for walks, but actually on a day-to-day basis, when you're grabbing things, when you're moving things about, your body is physically moving in ways that actually you're unaware of. But actually, because of the lockdown, it's meant that people have become a lot more sedentary and move a lot less. If people have naturally been in self-isolating or not going out, it means that there's a lack of sort of fresh air and a lack of being outside. And so nutritional levels like vitamin D levels have been impacted. And so therefore we've seen sort of some of the impacts of that. And with winter coming, that's something that's sort of really, really important to be focused on, especially for our immunity and our immune system. And I guess some of this focus is around people who've been outside and working from home. There's still some people who are continuing to work outside and using their body and being quite physical, but that focus is on some of these things that are a direct result of the lockdown. Online all the time. So, a lot of people are finding that they're in online meetings day in, day out, and in a way that they wouldn't be ordinarily, and they wouldn't be if they were sort of either in an office or in a community centre or in a community base. And so that impact, not only just on your attention, but on your eyes, has a big impact for your physical health as well. And also difficulty managing long-term health conditions. And that might be because the services that you usually go to or usually access are being restricted. They're digitalising them. It might be via the telephone. And also there's sort of that constant lure of food and drinks and everything that's around you all the time as well. And so, there might be difficulty that people have found managing long-term health conditions as well. And so, the advice, I guess, that's put forward is nothing new and nothing that I guess for anybody will be revolutionary. However, I think that there's just something collectively we have to do to hold ourselves to account, because it's incredibly hard. So, everybody says exercise 30 minutes a day. I find like sort of Zoom exercise is really hard to follow, and online, because I like to be out. So I go for walks. If I'm doing online ones, I'll do them in a group. And maybe, I don't know, you already might have this within yourselves as well, but creating just like an exercise network, and it's a bit of an accountability network. So it just means at least you're moving, and it doesn't have to be anything formalized. Just put your favorite songs on and just dance in the middle of the room, for 30 minutes or even for 10 minutes at each time, but just get your body moving. Yoga and stretching activities, and again, you might not be into yoga or want to do yoga, and just doing some simple stretches, and we'll send some links out for different simple stretches you can do, whether you sat down, whether you're lying down, or whether you stood up as well. It's just to get your body circulating. Some people find that when they're at home, they just drink a lot more tea, drink a lot more juice, but others find that they forget. And so dehydration is a problem, and that'll be something again that starts to come up, maybe with people that you're working with, especially if you're working with older adults who are living on their own. And so having an alarm just to remind you to just drink liquids is really, really helpful, because it just constantly just reminds you, especially if you sat in meetings online for a long time. And even though I work in technology, I endorse digital detoxes. And so being very boundaried about like time you spend online. For me, even this webinar, as great as it is, it's quite a long time to be just sat there looking at a screen. So schedule in like electronic fasts, so days where you're just not going to be online, and Obviously that's not possible for everybody, but making sure you book that time in, you really see the difference, because it's almost like it's a pull, that you can make yourself more available just because you're not moving as much. In your home or in your place of work, having just device-free zones and banning them, and especially for mental health and well-being as well, just banning phones from the bedroom. And so it gives you like that stop off. So I always say, when you wake up and you check your phone in the morning, is there any time that the news is good? So you're inviting sometimes anxiety in the morning, and many people are either looking at social media or checking their emails. And so do that when you get out of bed. Have a bit of a ritual that allows you a bit of self-care, and ban the devices from the bedroom. And in each day, this might be your exercise, this might just be going outside and breathing some fresh air. Build in time in the same way you would put in meetings for time away from technology, and time when you can either go for a walk in nature, you can go and have a bath, you can just do something where you don't have any technology that's around you. And it's screen time, and you start to see how sometimes the screen time and digital time is consuming you. So they're just like simple things. What we're not going to do at the moment is go into, I guess, specific physical health problems that people might have. We'll talk about long-term health conditions, but one of the things I would say is, if there's any questions around specific physical health problems, please do put them in the comments in the chat section and ask them as a question, because we can raise that and we can focus on that as well as we continue. Okay, so in relation to, I guess, mental health and well-being, I want to put a spotlight on two key things, and they're anxiety and sleep problems. There's a range of other things I think that will impact us, and I always say, by the very nature of the work that we do, we invite a fluctuation of our mental health into our lives, when we're running a business and we're running a social enterprise, and we feel responsible for the well-being in different ways of our teams and different communities. Comes in because there's a worry around, especially if you're in a business that's place-based and you have to close, what you can is caring responsibilities, family responsibilities that you're balancing, as well as balancing everything else. If there's financial worry, and financial restraints, and concerns around those, and I guess when you're again at home, you have more time to worry and more time to think, and unfortunately at this time there's nothing really to reassure us, because I think a lot of the information that we see and that we what anxiety looks like, and some things that you could do and put in place to manage the anxiety as well. And then secondary, also sleep problems. So I always say, like, anxiety, low mood, even like medication, just different things that are going on in our lives can impact our sleep. And our sleep is so crucial at this time, because it's where our body restores itself, and it's where our mind gets rid of all the things it doesn't need, and keeps all the memories that it does need. And so broken sleep, times not being able to get off to sleep, or the opposite, just wanting to stay in bed all the time, can again have an impact on how we operate and how we are able to run our enterprise. So I'm just going to touch upon again some tips for that, and then we'll move on to the organizations. At this point, does anybody have any questions or any comments? I'm just going to pause the share, and I know that in the chat there was a comment, so we'll come back to that. Okay. Michelle, you've put, you definitely noticed physical issues that have increased during lockdown, during lockdown, rather than mental, having to support the people's mental health issues being hard. Okay, understand that, yeah. Visually impaired, have seldom addressed sleep disorders. Okay, that's fine, we can touch upon that. Lots of support for yoga, great. Research suggests that individuals from BAME communities have much lower levels of vitamin D, so it's really important that their levels of vitamin D are okay, completely. And I think that the more melanin you have in your skin, the more vitamin D that you do need. And it's great if that can be outside. If you go outside for 20 minutes to an hour and you've got the sun, but we know that we're going into winter, and that is changing. And so vitamin D supplements are helpful, and also looking at foods, because actually I won't go into too much detail, but to absorb calcium into your bones, you need vitamin D as well. And so you can't absorb the calcium in your bones if you don't have vitamin D. So our body is amazing and it's all interlinked, and we need all these things to keep us going. So it's really crucial. Yoga's transformed my lockdown experience, but finding it harder now, it's getting wet and cold. Yeah, I mean, we'll touch upon some of those different things, and this is where I do think it's how different people can support each other to motivate ourselves naturally. With the weather changing and also the seasons changing, our circadian rhythms change as well. And so, really, we're not supposed to be operating in the middle of winter in the same that we operate in the middle of summer. However, we create these schedules for ourselves that we do. I feel that now there's this opportunity to really think about the schedule that works for you, and thinking about the times that you work as well. Because I think that, before it was 9 to 5 and people are so used to doing that, but really explore sort of about yourself and your body and think about when you are at your optimum and connect with other people. Hi, Naomi, I'd love for you to cover how we keep those who we look after in the community, i.e. social entrepreneurs and colleagues with their mental health, whilst ensuring our mental health doesn't get affected. Well, I'm going to touch upon some things now, specifically around anxiety and sleep problems, but what I'm happy to do afterwards is share all the further information and further resources with anybody. I think it's incredibly hard to sometimes boundary your own well-being, and at this time, this is a point where I would say everybody's mental health and well-being has been impacted. We're all dealing with a changing and difficult time, and also absorbing other people's emotions at that time can be incredibly difficult. So we will talk about some things about how we boundary. I'll go back to sharing my screen, and then I'll come back to the chat. So please keep chatting there. I'd love to see all the things that are popping up. Okay. So spotlight on anxiety. Yeah. Okay. Oh. Okay. So as many people know, and again, this might not be new information, but it's good always to sort of like feed that back, because I think sometimes normalizing how we're feeling at this time is also really important. But anxiety within us is like obviously part of our natural bodily response. The difference is, I guess, now what the situation and the pandemic and the media and the information that we're constantly exposed to does is it can sometimes leave us in this constant state of arousal. So we're constantly feeling anxious, we're constantly aware, and we're constantly on the edge. And that's not how our body's made to respond. It's made to respond to anxious and dangerous situations, but not prolonged dangerous situations. And that's where anxiety can start to get worse and develop further. So as you may know, we have different responses. So we feel something, fight mode, where we're ready to fight it. We either try to run away from it. Actually, we want to disappear. We don't want to see. I always give the example, a team, as soon as we found out what was happening, some people just froze. They couldn't think of any ideas, couldn't think of anything to do, because the situation was so big. And so sometimes we just freeze, and that can block our creativity, block our ability to think and make decisions as well. Or we flop, or we try to find a friend. I mean, I don't know if anybody's going to find a tiger right now, but these are some of the things that, like, our natural bodily responses and the natural way that we will respond to things will do. I guess lockdown has meant that physically people haven't been around us to see some of those different things, and so what happens is maybe sometimes that that fight is sort of like being within us, or that freeze that we've started to see a little bit more. And I always like to know what's happening in our body and our brains. So some maybe know, so we've got a part of our brain called the amygdala, and it's in the frontal lobe, which is the part of our brain that regulates our emotions and manages our emotions. But what happens, it triggers our fight and flight response, and then what that does is then sets our bodily system to respond to that danger. And so when people are talking to you about anxiety, or you're feeling it in yourself, usually it's a very physical feeling. And it might be thoughts, it might be constant worry, it might be dread that something's going to happen. But often what you can see is it physically. So, people's, like, you might feel like your heart's racing. This might be in a specific instance, so it might be panic and anxiety, heart racing. But again, if your heart's racing for a long period of time, that can have an impact. slower digestion, or the opposite, you're going to the toilet all the time, dilated pupils. It might find that parts of your body start to ache, so your shoulders, your lower back. And so that's what's happening, is the cortisol is growing in your body because it's getting ready to run or fight, but actually you're sedentary and you're not moving, so it's just still running around your body, and so therefore it's got nowhere to go, and so therefore that's where you can start to feel pain in your muscles and other parts as well. Okay, so that can be triggered by a thought. That can be definitely triggered by the situation that we find ourselves in. That's triggered by, when we get a financial report, or we get a no from, a funder, or, any different thing. So as a social entrepreneur, I would say that threat detector is triggered in us so often. And it's important to be aware of that, and also normalize that for people as well, because I think that it's not an easy space to be in, but if people know and are aware that actually it's going to impact their physical self as well as their emotional self, then they can do things to resolve it. I have this picture right now, and I guess there's not that many people in cinemas, but I feel that the things that we're watching and the things that we're seeing, and the things that we're seeing on social media and in the wider media are a massive source of anxiety for a lot of people at this time. And one simple way is to stop watching and to stop engaging with that media. But it's incredibly addictive. People want to be aware, and people want to know all the time. But I would say the things that we're seeing in anxiety, and because what it does is you have no control over it, or there's a perception you don't have control, and so therefore you taking in all this information with no ability to be able to feel like you can change anything. So the watching and the media really is fueling people's anxiety. And I think when now we're going into winter and people are going to be inside a lot more, and naturally we'll be watching television a lot more or listening to the radio, this is something that as people who are supporting running enterprises, we really need to focus our attention on, and think about alternatives and ways we can use our time. So what anxiety does is it focuses our attention on our problems, and the way that we can see it is the way we think about things, the way we feel about things, and the way we physically feel in our body. And for us at the moment, what we need to do actually is we need to be responsive, creative, and thinking of new ideas. And so what might be good is connecting with other people, but actually managing your anxiety allows you to be able to just think a little bit clearer. And even though we're in this area of uncertainty, realize that you can carve a small part out of which you can control and which you can have an impact on as well. So I would say that we all want to be like these chilled out hippos, feeling relaxed and connected and actually able to hug each other, but some things that maybe you can do, and also that you can advise and support other people to do when they're feeling anxious, is talk. Family, friends, I guess it's someone they trust, and everybody's feeling quite anxious at the moment, so I always say it's a bit contagious. So you might find that some people find it difficult to empathize or respond as well, so it's really important to find people that you trust, and for me, find other social entrepreneurs who are going through the same thing, because a lot of people don't understand what we're doing, why we're doing it, and there's a different driver within you. So I think that peer group is so important, and so helpful. And then again, there's professionals as well. So there is the psychological therapy services, and there's routes within the NHS. And we'll talk about opportunities again for your organisations as well to be able to support the emotional and mental well-being of different people. So talking. Putting your thoughts on trial, which is really hard when you're spiraling out of control, but other people might do, and these are really sort of useful questions to jot down, and you can have these slides as well, and just really questioning, does this really matter? Is this going to impact me now? Is it going to impact me in a few months? And really challenging some of the thoughts that you have in your mind, because a lot of the time we have practical worries like, oh, I've got to pick up the kids, or oh, is somebody feeling ill, or is this a symptom? And then we have worry about worry, and that worry about worry are things that we can't control. And so actually we need to be able to sort of make that distinction between sort of important worry that gets us up in the morning, and I guess destructive worry which we have no control over as well. Getting active, so we spoke about that with physical health as well, and that can look different. You can do chair exercises, like I say, dance in the room, go for walks, go for runs, just getting outside, because the physiological release of endorphins is really important. And we spoke about that adrenaline and cortisol, that when you're anxious is released. Well, the endorphins balance that out and they get rid of it. So that's why when we're really, really stressed, sometimes we want to just punch something, or we just have this overwhelming feeling within our body. So actually the exercise is really, really good for releasing the endorphins, which are sort of like happy hormones, but also getting rid of that cortisol and that adrenaline that's just running around your body. Deep breathing, and so a few people might practice breathing. I would say this is something that, again, to be doing like on the hour, and just reminding yourself on every time you go to the toilet, just sit on the toilet and practice a bit of breathing. Every time you're watching a TV show, practice a bit of breathing. And what I always suggest, and maybe I'd ask people to do that now, I can't see you, so I'm going to trust you doing it, just to take your left hand and put it on your chest, and take your right hand and put it on your stomach, and then just breathe in for 4, but fill up your belly like it's a balloon. So I'll count you in, and then breathe out for the count of 7, and just do that 2 times. So breathe in for 1, 2, 3, 4, out 2, 3, 4, 5, 6, 7, in 2, 3, 4, and out 2, 3, 4, 5, 6, 7. And there's different ways you can do it. There's so many different breathing exercises online, but I'd just take you out because it rebalances you as well. And that's a really good way of reducing some of the cortisol levels from anxiety. After a few rounds of that, you might feel a little bit lightheaded, but you will be all right. And so just checking in with your breathing every few hours is always a good thing. Write down, things you're worried about, like a story, but then put down positive solutions, and share them with your team as well. I think, you might be working alone, but you may have a team, and often we feel that we've got to, again, as leaders, solve everything ourselves. And actually other people might have better answers and better solutions as well. So, write these things down, because actually the process of writing gets it out of your head, and then sort of like look at all the different positive ways of working with it. And again, with writing, maybe having a time where you just allot yourself to worry. So, 10 o'clock in the morning, you're like, wait a second, I've got to wait till like 2 in the afternoon before I can worry about this. And so you're like scheduling that worry, and you write everything down, do it for 20 minutes, and then next day you have the worry time. So you're allotting the time to allow yourself to feel anxious as well, because sometimes what we try to do is fight the anxiety. If we just embrace it and immerse it in our day-to-day lives, and we welcome it, then we can allot it, and we can start to sort of like explore what it is that's making us feel like that as well. Progressive muscle relaxation. So again, I'll send some links where you can just do some muscle, and that's just like tightening your muscles and relaxing them. And why that's good is you start to notice when you're feeling tense, because a lot of the time people end up like the end of the day and they're sat like this, and physically you don't notice it, but actually just being able to be aware and just being able to lower your shoulders, release your back tension, think about your hips as well is really, really sort of useful to do. And not everybody, I don't say meditation is good for everybody, because I think sometimes it can open up a space of anxiety, but for some people find meditation and silence really, really helpful. And there's different types. So you can do visual meditation, which will take you to a beautiful mountain scene like you can see in the picture, or a beach scene. You can do music, and music is meditative as well, whether it's got lyrics or no lyrics, or there might be some specific guided meditations around goals, around love, and so having that practice in that space where you're focusing on really, really sort of like clearing your mind is really useful. And again, it's a useful habit to get into. So there are a few things around anxiety. Before I move on, does anybody have any questions? I'm just going to come back to the chat because I know we've got about 5 comments. And anybody have any thoughts or views just around anxiety? Lucy said, oh, well, everybody can actually see the chat. Yeah, I don't have a TV either. I do have a laptop though, which I'm realizing is increased use. But yeah, don't have a TV at all, and I feel that it's the best choice that I made. No worries, happy to share them, and I'll share some more, like I say, resourcing links. So that's something that you can work on with yourself, but also with the people that you're working on now. Okay, I'll move back to just touching upon sleep problems, because I know that already time-wise, and I knew this would happen, but we have got a bit more time. I'm going over, but let's touch on sleep problems, and then we'll get to the organisational side of things. So, you know, some people might sleep well, some people might not, but even after a bad night's sleep, you can perform. So quickly, physiologically with sleep, you probably need physically 4 hours sleep. 8 hours sleep is a normal cycle. And we go through like sleep cycles at about an hour and a half. So we have different stages. So REM is like the top level where you can usually be woken up by sounds, by smells, by worries. That's when you dream. And then stage 4 is the deepest level of sleep, which if you ever see anybody in that level of sleep, it's almost like they're unconscious. Well, they are unconscious. You know, you can't wake them up. They're usually quite cold. And that's the deeper stage where usually you're going through like physical restoration as well. So every hour and a half, we have a different sleep cycle where we come back up to the top. And usually if people find that they're having broken sleep, usually it'll be as part of one of the sleep cycles. So it might be after an hour and a half, it might be after 3 hours, it might be after 6 hours. And the second stage of our sleep becomes lighter. And that's when our thoughts are processed as well. So our memories, our brain gets rid of the things that it doesn't need. If you have any worries at that time, that's when these things might come up in dreams. And so physically, you can wake up after 4 hours sleep and function with your day. You know, there's a few, I guess, people who've famously told everybody that they only sleep 4 hours sleep. But again, now, because again, sometimes with anxiety and we're doing a lot in different ways, you want to think about how you get a regular night's sleep. So there'll be certain things that do impact your sleep: alcohol, worry, anxiety. It might mean that you can't get off to sleep. But bad sleep does impact our judgment. It can make us quite moody, quite snappy, and sometimes it can impact our ability to be able to cope with this increasingly difficult situation. So there's a few just quick tips around sleep. Anybody who wants any more information about sleep, I used to do a lot of sleep therapy, so I'm happy to share it and share a few good books as well. Bed is for sleeping and sex, quite simply. Not mobiles, not BuzzFeed, not social media, not everything else that we seem to do, not our laptops and last minute work if you have sleep problems, but I'd say anybody anyway. And if you're awake for like more than 20 minutes in bed, tossing and turning around, moving around, I'd say, you know, get up and find something like relaxing to do. That's not watching anything on Netflix, because Netflix is designed to keep you addicted and you could keep going for ages. So it might be like a book that's sort of like quite boring, or it might be looking at images. So something relaxing until you start to feel tired again. And the reason is the longer that you're in bed awake, the more you associate your bed with wakefulness, and you're awake. And so therefore what you want to start to do is reset and associate your bed with sleep. So as soon as you see your bed, you know that actually this is the time to sleep, and your body needs and your brain needs to be sending those signals as well. Keep doing that continuously, and you will find that actually you'll get into routine. I mean, now it's quite cold, so I know that people are like, actually I prefer to just be awake in bed than not. But I would try to keep your room warm and do physically get out and get back in. So there's this sort of 15-20 rule, as if you're awake for longer periods of time. And then there's certain things that call them sleep hygiene. So thinking about your physical space as well, so the light that's coming in. What happens is in, you know, winter we naturally wake up, but actually, I mean, in summer with the sunrise it's easier, but in winter it can be a bit harder. So looking at sort of like the timings that you have to wake up as well. Don't snooze. Sometimes there's some people who I know who have to wake up at like 7 o'clock, but they put the alarm on for 6 a.m. and then snooze because it feels like they're getting an extra hour. But all that's doing is breaking up your sleep. So don't do that. Try to put your alarm on for 7 and just get out of bed. I know it's incredibly hard, but try to get into that pattern, because all you're doing is you're taking away the hours worth of sleep that you could have in the morning. Limiting like noise as well, which is quite hard in some places, easier in other. Managing the room temperature, so not too hot, not too cold. If you can get your window open, getting fresh air in, or making sure every morning you're opening your windows as well, just to get some fresh air in the room. Not having your mobiles in, not having any clocks, making sure your bed's comfortable as well. And then again, when thinking about if anybody's finding it hard to get off to sleep, looking at some of those things around anxiety, because often just before you go to bed, that's when all the worries arrive, and you're just like, okay, brilliant, it's quiet, and then all your worries arrive and keep you awake. And so trying to practice some of the elements around sort of like anxiety and calming yourself down and relaxation before bed and getting yourself into a nice routine there. So again, happy to share any further information about sleep there. I'm going to pause, and I'm going to ask people to put any questions in the chat box, and then we will move into the next section. Great. Oh, I'm glad you're feeling more relaxed already. I'm glad your breathing exercises are great. There's some great ones online as well, which I can share. And, you know, sometimes they're only like 5 minutes or 3 minutes. And it's amazing the impact that just a quick breathing exercise can do. Totally agree. When you can't sleep, it's pointless laying there. Yeah, completely agree. I sleep through my first 3 alarms. Not nice for my partner. I bet it's not now. You're a night person, 2 a.m. till 9. That's great. I think if you know that you work better at certain times, try and adapt your life around that. And so, you know, I think again, this is back to using this time and this COVID time and this opportunity to really think about how you can reshape the work that you do around the optimum for your health and well-being as well. Teresa, I feel sleepy already. Well, I hope you had a good night's sleep, and maybe it's because of my constant drivel. So I will move on to the next topic as well. Thanks for the comments. Okay. So now thinking about, I guess, communities, and again, you know, I wouldn't say any of this information is exhaustive. I wouldn't even say some of it is completely apt and correct, because regionally what we're seeing is there's so many differences and there's so many changes that are happening specifically in health and well-being, access to support, and presenting problems, but also with then some of the restrictions and the policy and how they're being implemented in different places. And there's very few, you know, I think social sector and many civil service society sectors love writing reports and putting information out there, but actually because it's constantly learning from things, there's not much around, I guess, key trends that people are seeing, and what a lot of the things that you'll find is anecdotal, and you actually will become experts of what's happening in your local area. So that is one thing I would say. You know, the information that you're receiving from the people that you're working with, from other community organisations, start to collate that and collect that, because that is your community intelligence for what's happening as well. But one of the things, I guess, when thinking of responsiveness, of good examples of how people have been responsive, and everybody will have seen this, is the sort of mutual aids, and, you know, driven by Facebook and online platforms and communities that grew exponentially, providing support and practical support. It might be picking things up for people who are at home, but that was a really good example of how, I guess, online communities organically were created and grew, and that's something that I think the majority of organizations are grappling with, especially if they're place-based. How, when your organization was the hub of the community, and people can't use it, do you now translate that and turn that into something else? And so looking at these groups and these informal groups and partnering and collaborating with them is really, really key. Collaborating on prevention-led strategies as well. And so what has happened and what we've seen in COVID is everything's been focused on COVID. So all the money's gone to COVID, or the attention's been for COVID, and it's almost like every other health and mental health problem has been forgotten until now, because we're starting to see the impact of some of those things. And I'll go on and talk about some key areas specifically within the National Health Service, but also within local authorities that have been impacted and that we're going to see severe gaps in service provision for in the next few months. But now is the time to start thinking, okay, you know what, I know my community, I know the things, and we talk about isolation and we talk about loneliness. And they are very, very, very crucial and important elements that have a dramatic impact on people's well-being. But one of the difficulties that we've got alongside that is how you engage in this current context when there are restrictions. You know, what can you navigate? How do you navigate that? How do you do that in a sense that can be beneficial for your business and organization as well, and exploring some of those things. I think a lot of the, I guess, knee-jerk responses and policies that were put in place, you know, were there, like, you know, landlords couldn't chuck people out, basically, so it's giving housing security. Some of these things are starting to change, and we're seeing that, and especially with a lot more people losing jobs and employment increasing, I think that we're going to start to see a little bit more around housing insecurity, and that's visible on the streets as well with homelessness, but there's also an increase in hidden homelessness as well. And again, because of the time, you know, with Black Lives Matter, with a lot of, I guess, inclusion initiatives being spoke about, there's a very grave awareness of the fact that actually a lot of systems, whether they're health or whether the local authority, are actually systematically racist, and they have not been providing the services that they need to. And so therefore the inequalities that many people have faced from specific backgrounds are just exacerbated. And again, this is an opportunity for communities specifically from those backgrounds to really think about the needs and how they can address it in either a culturally or a socially appropriate way for those groups. I think that this is what we're seeing, and sometimes the focus is always on exposing inequalities, but as social entrepreneurs, what we can do is think, okay, we know these exist, what can we do to support that in a way that's sustainable for us, our communities and our organizations as well. So I think there's some of the things that I guess were rapidly put forward. We're starting to see now some, again, changes, and they're calling it lockdown, but it's not, but more restrictions on movement, which, you know, have changed from what we were able to do from the summer, which will have an impact again on place-based organisations. So, you know, impacts on NHS services, which I guess we're not always seeing, but we're starting to see, is that basically there's been a reduction in the care provision that's provided. But in addition to that, there's been a reduction in people actually going to NHS services. So, you know, ordinarily, obviously, people will go to their GP practice, people would go to A&E, maybe with questions. Obviously, women want to get in more calls, but actually people are accessing. So there's a worry about that, because that prevention that's taken place and that early identification is really, really being missed. And there's been a big adaptation on delivery, mainly because things have been delivered by telehealth, so telephone appointments, in a lot of different services. Or they've moved to digital, so they're online, they're chat based, or they might be video call based. And so that change in delivery for a lot of people that use the health service as a I guess a social broker, and was part of their life, has been incredibly difficult. Again, the reduction in A&E levels is I guess worrying, specifically for falls, and you know, with now what we're seeing and what we saw was a lot of people were fearful of going into A&E to catch COVID, and so therefore might have fallen but not said anything, or might be isolated and not be able to share that. So again, sort of there's quite a lot of innovation supporting people with falls, but there's also looking at the community around that. And I know there was the massive push from the NHS around volunteers, but we also know that actually there's still a lot of people who aren't being seen, and there's still a lot of gaps there. And in addition to that, the staff burnout now that we're starting to see. Obviously there was a lot of information about the exposure of frontline workers, but we're starting to see now the burnout across local authorities, across the social sectors, you know, and the NHS, of staff that are just exhausted, and that starts to have an impact on availability of appointments and availability of services. I'm just touching again, because these are sort of, again, things that are starting to think about with groups of people that you could provide services for. You could think about, again, prevention services for cancer care. We've found a reduce of people are presenting, and we'll have more and more figures as the time go on, but we're finding people are presenting substantially less in different areas. And so again, early identification is very, very key for cancer in all different areas of cancer. Physiotherapy, because physical appointments haven't been made, so people haven't been able to have physical appointments. In addition to to that, surgery, so elective surgeries like hip replacements and things like that have been stopped, paused, or rescheduled. And so what's happening with, alongside what we were talking about before, with people less mobile, is that we're finding physical health problems which could have been alleviated at an earlier time are actually becoming more severe when they didn't need to be. And again, an opportunity for social enterprises to think about how those services can be provided in alternative ways as well. There's currently a hashtag about maternity care because there's mass restrictions in certain different geographical areas. And again, this will be different in different areas. So it's important to know what's happening locally for you. And I can, again, share different channels and ways that you can find that out. But, you know, for pregnant women or women who were having baby, they weren't allowed their partners or anybody, a secondary person, to attend appointments. So there's been quite a lot of trauma for women who may have miscarried, who might have any long-term health problems alongside pregnancy. There is a hashtag and there are changings around that, but there are still restrictions, which again, when thinking about this new generation coming into the world, what impact is that having for early life, and also the trauma of women, especially women who might have emotional and mental health needs during pregnancy, and various long-term health conditions, you know, autoimmune problems, people who get bloods taken in the doctor, people who are constantly seeing. A lot of things have gone online. They've gone back to now being able to get bloods taken and going into different outpatient departments, but the process has changed quite dramatically, and a lot of consultations are still via the telephone. So there's been impacts on the delivery of services for a lot of people in the community and how they expect, but also that's been a big shift on how the NHS staff members and organisations have had to provide their services as well. In addition to that, when looking at local authorities, and I know that a few people I saw worked with care homes and in addictions, I mean, we've seen a lot about like social care in relation to older adults, but specifically for young people and young people who care experienced or looked after children, social services have had a massive impact. There's been a lot of staff who've been off sick, who've been in isolation. So that's really cut it down to a really bare thread service. And so that then has an impact on the vulnerability of children. Some aren't being seen for 6 weeks when really they should be seen weekly. And you know, little things where in the community, like a corner shop or like a community centre would regularly see young people, now they're sort of lost. And again, a lot of those services are being delivered over the phone. So I'm going to move on to key areas and ages, because again, when you work in a community where you work with all the community, but in health, health works in very siloed ways as well. This is in mental health and in physical health services as well. And so you have children's services, paediatric services, or children, young people services. You have adult services, which will go, well, children's go to 18 or up to 25. Adults will go from 18 25 up to 65, and then there's older adult services. So why it's important is because when you position it in any type of intervention, it's important to describe which group you're working with in those areas. And I think that with the big move of budgets being focused on COVID, actually some of these other areas might be neglected, and it's starting to think of, okay, you know what, this group might not be directly vulnerable of catching COVID or having COVID, but the impact of them not being able to access the services, the impact of the provision changing, is going to have a detrimental impact on their health and well-being as well. And so therefore your service or what you're doing can negate that somewhat. Okay, so I guess where can we move to and what can we look at? And that's where maybe some of this focus is, and I think there's more conversations to be had. New ways of engagement, new ways of service delivery, and new ways of creating community. I mean, for us, we did a lot of work with our Neuro Champions project in schools, and obviously all the schools closed. And so in March, I approached the local authority and said, you know, what are you doing for looked after children and care leavers? And so there was still sort of like debating and I guess scrambling about online interventions. So we rapidly built an online and digital intervention to provide psychological support, to provide social support for children and young people. But what that meant is we had to tap into local authorities, communities, partner with them, look at some of the structures and the barriers that they're working with as well. And so those things all really impacted the sort of delivery of services. However, it did present an opportunity for us because that wasn't necessarily happening. So that was an example of turning things online, but actually creating an intervention specifically for an online environment, not just taking something offline and putting it online. this point, I'm going to pause because I know we've got about 17 comments. I'm just going to go to the comments and see what people have stated. Okay, so like the idea of community. Oh,
I was just going to say, if it helps, because we've had quite a lot of chat, but just in terms of questions, there was one really great question from Madeline, which was, if you had 25 grand to spend related to independence, income and isolation, what would you focus on?
If you had 25 grand to spend related to independence, income and isolation, what would you spend it on? I guess that, I mean, I imagine you might have 25 grand to spend it. That's why there's a direct question there. It depends on who you're working with and it depends on what's happening. I think that what's going to happen over the next 6 months is there's going to be a lot of focus on digital-based interventions. One of the issues is there's a lack of digital skills that a lot of people have, older adults and also children, young people. You know, people think that they're tech whizzes, but actually accessing it in a certain kind of a way is very, very different. So I'd really focus on a group of people that Madeline, on disabled people along, is that Madeline, did you ask the question? Oh yes. On disabled people on long-term health conditions. Okay, is there any specific long-term health conditions, Madeline? It might be easier to just unmute and just yeah.
No, it's pain disabilities. So
sorry,
it's pain disabilities, all long-term health conditions, mainly working age rather than older people.
Okay. So I think that what I would look at doing, if it's pain disabilities, is looking at digital interventions at home. What's going to happen is people are not going to be able to attend centralized clinics and centralized bases, and there's quite a lot that's available. So I wouldn't say spend it on creating your own. I wouldn't say pay a consultancy either. I'd really look and do a bit of research with the people who you're working with, looking at what, I guess, skills and abilities they have to tap in, whether it's through mobiles, whether it's through their TVs, and then thinking about how you can provide something that can be regular to those people at home, whether it's workplaces or what have you. There's a lot of stuff, I guess, happening with virtual reality around pain management, and there's loads of research projects and people who are wanting to add. So I'd also say partner with the university or partner with other organizations who are delivering some of these things, because 25k can go very, very quickly. But what I can also do is, because this is my answer off the cuff, I can just take a bit more time, contact a few people and get back to you if that'd be helpful as well, Madeline. Yeah, I don't know if that's a yes or no. Please type or let me know. Yeah, okay, brilliant. I'll quickly go back just to do this. The thing about isolation is that people get lost. It's key to how to find them. Just trying to get a grant to do a community survey to assess needs. And I think that this is the key thing about communities. And I do think there's something to learn from the mutual aid groups, but again, there's so many people who are digitally excluded. You know, there's this assumption that everybody's got a mobile, that's got a smartphone, and actually that's not the case. So even text messaging, you know, and having the ability to be able to regularly send text messages to people, making sure people have credit, those are really, really key things that can support isolation as well, because it's fair enough creating these digital interventions that people can't actually access because they're already excluded. I know there's many parts of Merseyside where there's young people and there's older adults who don't have any access to technology, and so digital interventions for them are completely lost. But also with young people, there is the ability to be able to physically see people, and I'll go and move and just talk a little bit on I guess key areas that I think are sort of going to be important, food being one of them, and food delivery, which we're seeing being massively exploited by the private industry and the private sector, and looking at how that can be brought back into communities, but how you can also tap in a service which is befriending, or it's just regularly seeing someone alongside food delivery services as well, and healthy food delivery services. Okay. So Okay, so presenting issues, and I guess these are areas that some people are already working in, some people might not, but presenting issues that may worsen over the next 6 months in areas of health and well-being. So long-term physical health conditions, and that might be because of management, but it's also because of access to the services and isolation. So people going to appointments, the actual provision that's available for them as well, and alongside that is like if people have multiple long-term health conditions as well, how they're supported and managed. Mental health and well-being. So obviously we spoke about anxiety, and these anxiety, low mood, depression, panic are all seen as like common mental health problems, but more severe and enduring mental health problems like psychosis, like eating disorders, like post-traumatic stress, again, because a lot of these services are being digitalized, there's been a lack of human contact. Now for some people that has been fantastic and some people really love the digital delivery. For other people it's meant they've completely disengaged. And again, if people are sort of like anxious and paranoid, you know, the concept of doing things online can really, really have an impact. So one of the things we've been doing is been talking to a big project at the moment around digital interventions, of family-based digital interventions, but for people with psychosis and what that needs to look like, because it's not a matter of just doing things via video call. There's other ways that need to work. But we're also, I guess, naturally what happens anyway, especially around January, February, is there's a peak in suicides. But again, I hope that this is not the case, but because what we're seeing is mass unemployment, we're seeing mass anxiety. The worry is that, you know, suicidal thoughts, suicidal action and suicides may increase. And again, with social isolation, this is a big concern. And so I think that, you know, why I say the body and everything's connected, keeping connected, and specifically with men, because for men under the age of 45, it might be 55 now, suicide is the biggest killer. And so we know that men are very, very vulnerable. And so targeted support and interventions for men and young boys as well around this time is really, really important when thinking about suicide. It's not to negate other groups as well, and pregnant women postpartum who've just had a child, especially if they're depressed. There's a very high suicide rate as well there, which is so worrying, concerning, and especially with the changes in maternity care, that's something. So again, with mental health and well-being, that constant contact and talk is really, really important. Physical health problems also caused by then weight gain as well, because people are mobile and at home a lot more, not exercising. So the physical health problems that can come from that, and the types of food people are eating, diabetes that we might see. And again, linked to that is increase in alcohol use and drug use as well. So we've seen, especially in, I guess, like middle class communities, there's been a mass increase in alcohol intake and alcohol use. And so there's a concern around this rising group now, and this secret alcoholism that's occurring. Loneliness and social isolation, which we spoke about, and underpins all of these things, because if you don't see people, if you're not connected with people, one, you can't notice, one, you can't support, one, you can't express how you're feeling. The lack of safe spaces, a lot of people don't want to always go online and share their life and share their world. You know, that regular cafe that people go to has been safe. So it's looking at, again, how we can make things either COVID secure or you know, and be supported as a sector to ensure that these safe spaces offline and online are maintained. Increasing online use, so through meetings, through accessing services online by default, that means more people are just online more, and so then that comes with other different problems as well. And because we're going into the winter period, we know the impact of cold homes and lack of heating. The government have brought a few initiatives in, but we know specifically older adults will freeze at home and aren't always coming to the forefront. So that means that we need to be regularly seeing people, but also now more increasingly, because families and people are working from home, their heating bills are going to be much higher than what they ordinarily have been. So it's looking at that financial support that can be provided. Access to healthy food, which I spoke about. You know, there are all these online services, but most of them aren't healthy. And, you know, people still, I think there's still a massive gap for good home cooked grub delivered, and good home cooked food. And I think that links with health, diet, exercise, all of those different things. And then sexual exploitation, grooming. And so there's a lot of vulnerable young people who are not being seen by families, by schools, by communities. And so this is another presenting issue that may worsen over the next 6 months. So the reason why I'm raising these to you is because that whether you're applying for funding, whether you're going for commissions, whether you're talking to local authorities, these are some of the factors that are really important to raise when thinking about shifting maybe what services or who you're providing the support for as well. And just to make it explicit, and some people might be aware of this as well, categories in health are quite important. So you'll have children and young people, like I said, you've got older adults, and these I think are categories where there's increased vulnerabilities during this period and increased need. So children, young people, older adults, pregnant women, and women who are in the in early years as well. We spoke about families in early years, and people with disabilities, physical disabilities, learning disabilities, are already historically excluded from mainstream services in a way that's just not appropriate. And so this again is exacerbated because a lot of day centres, a lot of services have closed, and there's also physical vulnerability of illness as well. And so thinking about disabilities as well in your mainstream work, it doesn't have to be a specific service that's providing support for people with disabilities, but thinking about inclusivity around the provision is so important. People with caring responsibilities and people from Black, Asian and migrant communities as well, who again are being marginalised and sidelined from different support services. Okay, so they're the categories. And then health impacts are long-term conditions, and I know a few people are working there, people with learning disabilities, physical disabilities, mental ill health and emotional needs, and multiple health problems. And I'm happy to, if anybody wants any more clarification on different areas, cover those. But I think that if you haven't worked in health before, it's really useful just to know some of the labels and the language and the titles that different people use that will categorize, because some of these areas actually are now their priority areas, because they know that they need to provide services for these particular groups of people because they've either been made vulnerable because of the impact of the service provision because of COVID, or they're more vulnerable to COVID. So yeah. Again, I'm going to quickly pause, and then I've not got that much longer for the final bit, which is looking at you and your organisation. So any questions? Gambling presentations up massively, hidden addiction, high suicide rates in younger men. Yes, definitely, Graham. And also because there's sort of been a push now for online gambling, and it's been very hidden, and I've seen a lot of the gambling organizations also alongside saying how can you safely gamble. So there's adverts around safe gambling, but actually they're still raising the gambling issue, and it's only going to get more and more it's only become more and more of a problem because people are losing their jobs. And so definitely drugs have gone up tremendously, and gang violence, yeah, definitely. And again, there might be something around us all collectively putting something together. And again, this is community intelligence, sharing some of this information. We're delivering surplus foods to 150 people a week. We've already had 3 interventions due to safeguarding, so really being an eye-opener about what isolated people are experiencing completely. And I think that, again, a lot of people don't know what's been going on, unless you're working, because it's so compartmentalized, all these different sectors, it's very, very hidden. Exploitation, vulnerability, and so we're starting to see it. And again, you mentioned safeguarding there, and this massive concern a lot of the time people have about working in mental health or working with children is around safeguarding. But one of the things that we've got to realize is that actually, there's still massive gaps, and that's something that SSE wider, but also other organizations can support you with in thinking about how you can manage this safeguarding approaches your organization takes. Often the way you work with people is more human, and it connects with people. And I think there's so much learning, I think, from some of these safeguarding issues that we're starting to see now. We did a lot of stuff around like youth work, and obviously a lot of youth workers are out in the parks, so we were like, how do you become digital youth workers? Now, youth work as a profession actually has been very scared about using technology and WhatsApp and messaging, but actually that's where a lot of young people are communicating. So we've been sort of like supporting and training people around how you become digital youth workers, how you take that same offline approach of engagement, which is so fantastic for youth work and community engagement, and you take it online without fear, and without organizational fear, and how you can do that. And I think, again, organizations that are starting to do that as well are really, really going to be at the forefront of service provision over the next few months. Any other particular questions? Really interesting. We're in a pretty well off, albeit next to 2 mostly private estates in Milton Keynes. The idea of secret alcoholism, so right. So many people I know seem to drink a bottle of wine a night and think it's perfectly okay. Definitely people drinking more during lockdown. Also the redundancies are coming up. Yeah, definitely. And I think it's, you know, it's raising that awareness, but actually, you know, I always say, why are people doing it? And it's sedate them, you know, often it's because of anxiety. They don't want to worry. And that one glass turns into two, which turns into three, which turns into four. And now everything's online a lot of the time. So people are getting the deliveries. So there's not even that, I guess, social barrier sometimes for certain people. It's not for everybody, of buying large amounts of alcohol and having them in your house and constantly being able to see them. So it is something, especially I think over the winter months, that we're going to have to really look at and think about how we can support people. And I always don't think it's useful to say you shouldn't do this. It's exploring why you're doing this. It's the why rather than the punitive sort of don't do this. Okay. I support social entrepreneurs in a group and one-to-one. I've noticed that mental health issues have increased with depression and anxiety. What's the best way to help them in a boundaried way? What I can do is I'll send support. I think I'll send some information. One of the things is within your time, a lot in certain times for them to talk about certain things. So, you know, and have it as a dedicated session focused on their mental health and well-being. I think one of the things that's come up in social enterprise, everybody's so focused on finance, marketing, business strategy, business plan. I think that one of the things that we need to prioritize more is having specific mental health and wellbeing sessions. Explaining, you know, you're not a therapist, and also you having your own supervision and support is very important, because you will absorb what people are saying, and also sometimes we go into this help seeker mode where we feel we've got to do everything to save somebody, and so that's really important. Madeleine's put weekly lunchtime huddles, fantastic, peer support and group support, and, you know, action learning, but doing it focused on mental health and well-being, you know, and themselves, is something really important. So I can send some more info, Michelle. We've got 5 minutes. What I'm going to do is I'm going to send some of the rest of the presentation over. I'm just quickly going to touch upon things that you could do and opportunities for organisations. So I'd ask now, if anybody's got some questions, please pop them in the chat box. Please do that now. Okay. So exploring opportunities for yourself and in health and well-being, and again we touched upon them just by thinking of some of the problems that we are seeing, but I think there's these are a few simple ones. Food. Everybody's going to need food, and in winter, you know, access to food is different, and, you know, even like students we're seeing now, you know, they're in halls, and healthy food. I think for community cafes, I think for community organizations, creating, because Meals on Wheels and things like that have shifted and changed. I saw that one of the organisations already been delivering meals, healthy, cost-effective meals, and having a community-based delivery service is something that I think there's a big gap from. You know, we know the likes of Deliveroo and Uber are making a lot of money out of this COVID period, and the food isn't always the best. So I think food is something, because that links with diet, that links with nutrition, and that's something, again, you can go to different funders and you can really sort of like put forward. Social prescribing is, again, with people prescribe medicine, but they'll prescribe social activities. So having clarity around the services that you provide and how they can fit with social prescribing in your area, and again, more information can be shared on that, or you can Google it. You can find out a lot of information about social prescribing. Looking at how you digitalize your services, but not just taking it from offline online, and working with people or speaking to other entrepreneurs who have done that. I'm happy to speak to people as well, because we've done that. Thinking about the mental health provision, because mental health is going to be a big area. It's a big growing area. It's a big topic, from central government, from the NHS, and from communities and families. And so thinking about what provision you can provide, or how you can skill yourself up in that area, what skills you need as an organisation. And partnering for services, and I'm all about collaborations and partnerships right now, how you can complement with each other and how you can complement other people. So these are just some of the people that, you know, I think obviously you're aware of: local authorities, businesses, trusts, universities, departments. Touched upon that. If you've got no experience, speak to other entrepreneurs who do. Identify trends in your community. And I think this community intelligence and things that people have put is really key. I'm happy to elaborate further. Won't go on the take-home points, but I will open to questions, and I'll stop it right now. I've gone over a little bit, but I feel that hopefully it was useful. So any questions that that people might have right now.
So do feel free to ask questions if you've got anybody but I'll just, maybe while you're just pondering, I'll just maybe just give a couple of wrap up reflections for myself. I mean, the first thing that jumps out to me is, goodness, what an important topic, and I'm so pleased that we've run this webinar. But so just a really vital topic that I just think you've covered and explained so comprehensively. So thanks a lot. I think I'm just from the level of interaction in the chat, I think hopefully we can see that really has been extremely useful. Just again, people do feel free to pop in on chat, but just to wrap up, a few reflections from me, and this is not going to cover everything that you've talked about, but just really reiterating the importance of looking after yourself first, so you and your team, so that you're able to then support your communities, but actually that many of those tips for yourself are things that you can share with your communities, and there are some quite simple-ish ways that you can do that without needing to be an expert in mental or physical health. So I think thinking about kind of accessible ways that you can consider this stuff, and so they're really helpful on that. But just really that the context has changed, and that the community need has shifted. And so it's really helpful to think about what are we seeing now and what can we expect in the next 6 months, so that community businesses, social entrepreneurs can really think about how they build their products and services and their activities to really meet those needs. But I think there was one point that somebody said at the beginning about whoever you are and your life circumstances, for everybody, the experience of COVID has been in some way a low-level trauma. For some people, it's a very high-level trauma. But just, I think it's really important to have that noted, that we're all affected one way or another and in different ways. And it's just a matter of tailoring and scaling our interventions appropriately. So it looks like there's just one question I'm noting that I think maybe let's take this one question and then we'll wrap up. So it was, what would be your number one starting point to encourage my board to go for?
I mean, I'm biased, but I always say mental health. I think that prioritizing the health and well-being of the organisation and mental health, and I think that also as an area of working, whether you're working with people with learning disabilities, whether you're working with carers, whether you're working with communities, it's something that's going to really impact everybody. And so I think that looking at how you support yourselves as the team, how you create like different environments of working, especially when people are working online and digitally as well, but also how with the services that you're providing, mental health is one of the key areas and one of the key priorities that you're thinking about, and the board are thinking about in the direction, because it will be over the next sort of six months to a year. I mean beyond, but definitely that time. So hopefully that answered, Sally.
Hopefully. Okay, so I think let's wrap up, but I just want to just ask you, do you want to just say how people can find you again, because I've got a feeling you might get a few questions.
Oh yeah, okay, let me just quickly I'll just quickly put my details up. So feel free to email me, Naomi@chanuahealth.com. I'm on Twitter @socialnaomi, so feel free to tag me. However, I'm having a Twitter break this week, so I'm probably not going to respond, but it'll be nice for me to arrive with messages if you would like to follow me there. And then we've got information at Chanua or Neuro Champions, and Neuro Love actually is the children and young people's platform that we set up, so feel free to look at that. So yeah, drop me an email. I look forward to hearing and connecting with you, and if I don't, I just say good luck. You know, we are all in this as much as we can be together, so yeah.
Well, there we go. So yeah, massive thanks again. Thanks Naomi, and I'm sure you'll get some questions. This has been a really fantastic session, so thanks very much everybody.
Thanks.